name is Nazila Kani-Vogelsang, and I am a registered nurse at the Royal Alaka Hospital at the Lois Hill Hospital for Women. The way the Pronox works is that the gases, nitrous oxide and oxygen, are piped in into the walls, and they come out through the Pronox device. And how it gets to the patient is with tubing. So the tubing is hooked up to the Pronox device, and then the patient uses the tubing, inserts it in their mouth, and holds it there while the contraction is going on, and breathes it in deeply and blows it out. And once the contraction is over, they can put it away to the side. During the contraction, the nitrous oxide, the Pronox, is working to relax the mom as much as possible and distract her and coordinate her breathing at the same time. So it does all these three things, and it's very useful sometimes in the early stages of labor if we need to use it then, just to get the patient to a good centimeter that we would need so then they can have an epidural. And sometimes we use it in the fairly late stages of labor for a mom that's been laboring naturally for a long time and just needs to get over the hump. The old way of doing things for the nitrous oxide is that we used to have oxygen canisters and nitrous canisters on blended already on a wheelie cart, and we would still have to get the tubing as we do now, but it was on a cart. So when the gases would run out, we'd have to change the tanks, and that can be very tedious in terms of moving the tank out of the room, going to grab another one which is off the unit, and then bringing it back. So that delays the care that the patient would receive in between contractions. The fact that it is piped in currently makes it a lot easier that we just need to get the tubing and never have to worry if we have enough tanks ready to go.
Hi, I'm Janie Klink, Executive Director for Women's Health at the Lois Hill Hospital for Women and the Sturgeon. So these machines are unique ultrasound machines called Sonocyte Edge, and they're actually indicated for use in an operating room situation, and they're really valuable for particularly high-risk patients. They help to identify anatomy underneath the skin for patients. So they would be used for things like placement of central lines. So if a patient has lost a fair bit of blood volume and need a large bore central line inserted, the ultrasound helps the anesthetist identify underneath the skin where exactly to insert that line. It's very difficult to do so without the ultrasound capability. The other thing it would be used for is to identify nerve bundles and areas that there would be nerves used for regional anesthetic, so for epidurals and pain control. Often regional nerve anesthesia is used, so these ultrasound machines will help to identify where those nerves are exactly to eliminate multiple attempts to get the anesthetic in the right spot. Heartfelt thanks, and just really want to send our sincere appreciation for your continued generosity and support. We certainly couldn't do it without you. Last year, for sure, the Pronox installation in the patient rooms has been exceedingly valuable for patients and for staff. And this year now, consideration of our ask for the new technology ultrasounds, which again will advance care to the standard in which we strive as a leading edge women's hospital. Thank you.